Hello everyone, my name is Sherifat Abdusalam. I'm here today to perform subcutaneous injection. First, I've gathered my supply. I have my gloves, I have the injection site, I have the vial, and I have the needle, the syringe, gauze, aqua soap, and bandage. I'll first verify the physician's order against the medication rights, which is to have the right patient, the right drug, the right dose, the right route, the right time, and the right documentation. Excuse me. Once I have that, I'll verify again with the EHR to confirm it's properly transcribed. And at this point, the order states to administer 1,000 units heparin subcutaneously times 1 dose. The heparin that I have at hand is 10,000 units per 10 ml. I'm going to do my calculation, which is going to be the doctor's order over what I have at hand times the volume, which will give me 1 ml, which is 1,000 over 10,000 times 10, then it's going to give me 1 ml. Once I've done my dosage calculation, I'm going to gather my supply. I'm going to the patient's room, knock, provide privacy, introduce myself to the patient. My name is Sherifat. I identify the patients 2 ways. Verify that with a wristband. If there are people in the room, I'll ask if the patient wants them around. This is for HIPAA protection. I'll ask the patient if they have any known food, drug, or seasonal allergies. If they say they don't have that, I'll tell the patient the purpose of the visit, which is to let them know the doctor has ordered to administer heparin injection to them. And heparin is an anticoagulant, and what it does is to prevent blood clot and treat blood clot by breaking it down. So once I'll let the patient know that the injection site, it's common if they experience some pinching or burning while it's being given, it's normal. However, some common side effects that happen when you give heparin is to have some bruising and some irritation, some discoloration around the injection site, and then other more adverse effect is to experience continuous bleeding, experiencing some nausea, vomiting, and seeing some blood in the urine or stool. Once this happens, the patient, I'll let the patient know to notify staff so that we can tell the provider. And I also let them know, because it's an anticoagulant, they have more risk of bleeding, and they should be very careful about how they treat themselves at the time they are getting heparin injection. I will ask if they have any question. If they don't have any question, I'll perform hand hygiene and wear my gloves. Once I've done that, I'm going to do another verification. My vial says 10,000 units per 10 ml. I've already done my dosage calculation. I'm only using 1 ml. I'm going to verify the order. It's heparin 1,000 units, which is now 1 ml, subcutaneously times 1 dose. I'll bring out the medication, the vial from the EHR, from the med card. At that point in time, it has not expired. I have checked, medication is still valid. First thing I'm going to do, I'm going to also check my needle. Right now I'm using the 1 ml needle. Normal subcutaneous needle is actually 25 G by 5/8 inches, but here I have the 25 inch by 1 inch. This is assuming the size of the patient requires a 1 inch needle. So for this, I'm going to remove the needle. I always like to cap the needle before removing it from the strap. Once that is done, I'll place that down. Take my alcohol swab, and clean the top of the vial. Once that is clean, I'll first of all make sure it's 1 ml. I'll make sure I pull the plunger to 1 ml to make sure I can push 1 ml here in before drawing the heparin. Straight down as if I'm holding a pencil. Gently invert the vial, push the air in, and then draw. So if there are bubbles at this point, I'm going to tap. If there is more that I want to push up, I can flip. Once I've established is 1 ml, I'll gently remove the vial, place down. And if the patient is not with me, I'm going to cap, do the 1 hand cap. This is 1 ml. At this point, I'm going to do my third verification with the MA to make sure I have the right medication, which is heparin, the right dose, which is 1 ml. The route is subcutaneous. The time is now because it's 1 dose, and I'll do the documentation later. I have the right patient in front of me because I've identified them 2 ways. Once that is done, I'm going to set all my material aside. For the administration, subcutaneous can be done either with the upper arm. You can do it, you can administer in the leg or on the abdomen, the left or right lower quadrant for the abdomen to be administered. When I confirm that, the other process is to make sure after I clean the surface, I will measure the needle. I'll pinch the skin, measure the needle, and make sure the needle is halfway with the skin pinching, so that way I will know when to administer, how far I'm going into the skin. I'll take the alcohol swab. I'm going to clean the surface. At this time, the patient prefers to use the abdomen. I'm going to clean the surface, and I'm going to do that inward to outward by 2 inches. I will let it air dry. I'm not going to blow dry it. I'm going to let it air dry. Once that is done, I'm going to take the needle. Heparin subcutaneous is going to be administered at 45 to 90 degrees. And the way it's going to be done is I'm going to pinch the skin, and because it's heparin, I would like to hold the skin pinched throughout administration. I'll take off the cap. Before administering, I will have checked the skin, palpate the skin, make sure there is no bruise, the skin integrity is intact, there are no bumps or anything around the skin before administering the insulin. So for the administration, I'm going to pinch the skin, use my dominant hand and go in straight, gently but quickly, going straight. With my non-dominant hand, I'm going to hold still while pinching. Is preferably heparin medication should be administered slowly while it's being pinched, and then I'm going to administer that slowly over 30 seconds. If it's a safety needle, it will snap, but this is not a safety needle. I'll quickly remove the needle and release the skin at this point. I'm going to place a gauze over the skin. I'm not going to massage or press it. The needle will not be recapped. It will be disposed in a waste disposal or a biohazard bag. If it's a needle that have security. I'll push the security before disposing. Once that is done, I'll make sure, if the patient prefer, I can put a band-aid over it. I'll place the patient in a good position. Do you have any question for me? Are you comfortable? Once that is done, I'm going to gather the used supply. I'm going to take off my gloves, perform another hand hygiene, and document. Thank you.